last time take the first place?
Thank you very much, Jim. That's a very good question. Canadians, when I knock on doors, are very concerned about health care. Some of the special segment that's concerned about health care is our new immigrants that come into Canada and do not have health care coverage. And some of the older immigrants sometimes have a backlash towards the new immigrants, saying that, you know, they're coming and they're using our health care, which is a total myth. Mm-hmm. Now, in terms of the overall cost of health, it will increase because of the aging population, but we must look at ways to slow it down and or fund it better. So how do we do that? One of our planks in our platform is to have a elder care program, which means that Canadians can take time off work to look after their ill parents or grandparents, up to 6 months, to look after them at home. I can give you an example. My mom didn't want to pass away in the hospital, so she stayed home, and we looked after her at home with my brother. He took the mornings, I took the afternoons. Now, if she had gone to the hospital, the cost for her care at the hospital for the last 2-3 months that she was gravely ill would have been going through the roof. The fact that we chose to keep her at home and she didn't want to go to the institutions, as I feel most of the Chinese Canadians, older people, don't want to go to the hospitals because it's not like home. The food is not like home, the language is not like home, and the culture is not at home like home. So that's one of the ways we can cut the cost of health care, by looking after our elder at home.
All right, TRIFON HAITAS, it's your turn.
Thank you for the very important question, Dr. Tan. One of the things that we've found whilst analyzing the healthcare system is that much of the money that's being wasted, in our opinion, is going to the pharmaceutical industry. And that is driving our cost to unprecedented levels. What we need to do is refocus what's important in our community, whether it is paying outrageous prices for our prescription drugs, or whether it is to put the money that we would otherwise use in the pharmacy to the frontline workers. What we need in our healthcare system is more frontline workers, and we need to invest in those workers. And by taking some of that money away from things like jet airplanes that will cost us billions of dollars, and prison institutions that will cost us that much more, billions of dollars, we need to restructure our way of thinking so that we can have a community that is based on universal health care and that focuses on providing the services that our children need. We have a wonderful institution here, the Sick Children's Foundation, that's doing a world-class job taking care of the children. We need to focus our attention on building infrastructures to maintain that first-class position. We need to focus our attention on caring for the elderly, because that is something that I believe will bring dignity and show the true virtue of our Canadian institutions.
All right, Janice.
Hi, well, there's something every Canadian can do. We need to lose weight. I'm on that list too. We need to stop smoking, stop drinking, and be active. I do get active, which is really important because prevention is the key. You know, we can't just live anyway and expect our government to pay for all of it. We will not have enough money. We also need to work on the environment, you know, get some cars off the road because the number of children with asthma is way too high. We need to look at, just as Mr. Temelkovski says, helping our seniors stay at home, which is where they prefer to be and where they will live longer, you know, and live healthier. The number of infections, my husband's grandmother just passed away right after Christmas, and unfortunately, because she had broken, you know, her hip, she ended up having to be in an institution. And you know, the care is not the same. As much as I love our nurses and our doctors, they don't have the time to give the same care. But our caregivers are burning out. So the NDP wants to put home care services right on the list with everything else that Canadians can count on from our healthcare system. Someone to come in and help at night, or to help change bandages, or, you know, to do more medical things that maybe relatives are not so confident in doing, to give our caregivers at home a break. And we also are looking at the 6-month time frame for someone to be able to collect EI benefits while they're staying at home looking after somebody. We also need more family doctors, because doctors want to be specialists where they'll make more money, but family doctors are preventative in nature. You know, they will see you regularly. There are so many people in Canada without a family doctor right now. So we will forgive student loans for medical students if they agree to be a family doctor for 10 years after graduating before they specialize, which I think will help quite a bit as well.
I'm going back to university, I think. All right, debating time. I'd like to hear something from the Green Party first.
Yes. One of the key features about the Green Party is prevention. We believe by maintaining a clean environment, we will have a foundation that provides for a healthy community. And a healthy community creates a prosperous community. But everything is laid down on the foundations of the environment, because it is that in which we all depend on and which we all live on. I agree that prevention is the key to our healthcare crisis. But most importantly, I do believe that we need to refocus where our hard-earned tax dollars are going. Do we want it to go into military spending, or do we want it to go into nurturing our constituents, our people? And that's the question that we need to ask ourselves when we go to the polls.
Sure, Louis, what is the passion?
Most of the people I've spoken to at the doors, TRIFON and Janice, as I'm sure you've heard from, they're not in favor of jets in prisons. You know, they're in favor of the family. They're in favor of what is the government going to do for them, for their health care needs. And health care needs are increasing. I was the vice chair of the health committee in Ottawa for about a year and a half. And we heard from diverse groups, from the medical associations, from the provincial association, as well as from people that were affected, and have health care at their heart of their life and business. And they're telling us that we've got to manage it properly. We've got to have a prevention program like the participation, which the Conservatives had cancelled, and not to focus on prisons, which is the end product. We got to look at the preventative products: early childhood learning, education. You know, having that $4,000 to send more people, more students to colleges and universities. That equip the people with more education, more knowledge. The health will come with it. That's part and parcel of that one package.
My English teacher, I think you have more to say.
English tutor.
English tutor.
We also need to be more creative on how we spend our health dollars. You know, the old system of doctors and nurses is not enough anymore. We need more nurse practitioners. We need more other kind of specialist, holistic. Many Canadians are now into natural medicines and holistic preventative medicines, and we need to make room for those in clinics where people can see, you know, where we're not all paying a doctor to check if we have strep throat or not. You know, this is something that can be done with someone who's paid a lot less, you know, so that the doctors can then concentrate on serious problems where, you know, we absolutely need a doctor. And pharmaceuticals, I'm right on board with that.
Definitely.
You know.
Tutor got a heading answer to professor, so can I just get the professor's mark?
I think one of the main reasons why we have high costs in medical care is our food safety. I just wonder, like, what can be done to eliminate the use of growth hormone or like antibiotic injection in rearing animals for human consumption?
If I may, part of the food consumption and the food safety issue was addressed and will continue to be addressed, but the current government cut down on the number of inspectors that are out in the communities to look after our health and welfare. So they were not there to inspect when beef is prepared for our tables. When imports are coming in, they're not looking at them properly. You know, having found some steel or it was metals in some of the, even the children's toys. You know, they were not being picked up because the conservative government simply kept cutting. I mean, you can lower taxes, which we all love. But what happens is, what the end result of lower taxes is that you and I will have less food inspectors, less children's teachers or guidance teachers, or less healthcare workers.
If I may also interject here, I believe that we have a wonderful opportunity in Oakridges, Markham, where we can actually grow our food locally. We need to start supporting our local farmers. I, too, came from an agrarian lifestyle.
So I have to interrupt you. Thank you very much for all the answers and questions. And also, after break, call me up.